Respiration is a core ASM step to topic, and mnemonics help retain high-yield facts quickly. The mnemonic TV RV, the very important exam reminder, summarizes lung volumes. Tidal volume TV, inspiratory reserve volume ERV, expiratory reserve volume ERV, and residual volume RV. A key point is that residual volume cannot be measured by spirometry, remembered by the phrase residual remains. Alveolar ventilation is best remembered by the mnemonic. Deep is better than fast, effective. Ventilation depends on tidal volume minus dead space, multiplied by respiratory rate. Rapid, shallow breathing increases dead space ventilation and reduces alveolar gas exchange, a concept frequently tested in anxiety and respiratory failure scenarios. Ventilation perfusion VQ relationships are critical. Dead space is ventilation without perfusion, remembered as P equals plenty of air. Empty blood, commonly seen in pulmonary embolism. Shunt is perfusion without ventilation, summarized as shunt equals stuck blood, seen in pneumonia, ARDS, or atelectasis. These extremes explain why oxygen therapy works poorly in shunts but well in dead space. Causes of hypoxemia are summarized by VQ match. V or Q mismatch most common. Low cardiac output, altitude, thick membrane fibrosis, co-poisoning, hypoventilation. The oxygen-hemoglobin dissociation curve is summarized by cadet face right for rightward shifts, indicating decreased hemoglobin affinity for oxygen. This includes increased acid low pH, DPG exercise, and temperature. Left shifts occur with fetal hemoglobin, carbon monoxide poisoning, alkalosis, and hypothermia. Breathing regulation is driven mainly by carbon dioxide. The mnemonic CO controls breathing, emphasizes that central chemoreceptors respond to CO levels, while peripheral chemoreceptors respond to low oxygen levels. POW 60 mg/am, especially important in COPD patients. Obstructive and restrictive lung diseases are differentiated using O equals out is hard for obstructive disease, decreased FVC, increased RV, and R equals reduced lungs for restrictive disease, decreased TLC with normal or increased FVC. Carbon monoxide poisoning is remembered by CO equals crimson oxygen layer, highlighting normal POW with low oxygen saturation, treated with 100% oxygen. Finally, COPD phenotypes are summarized as blue, bloater equals chronic bronchitis, and pink, puffer equals emphysema, classic step 2.